Hey guys, welcome back to Medical Coding with Blue. Today's episode is the pros and cons of taking on a temporary or contract position as your first job as a medical coder versus holding out for a permanent position. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, when it comes to starting off brand new as a medical coder, and maybe you've gotten your certification and you see everybody is asking for experience. Oh, this guy is fallen. We all want experience. We all want experience. Guys, employers are lazy. They don't want to have to train. That's the big deal about it. And there is so much to learning medical coding that it is almost overwhelming sometimes for a lot of people. Just the thought of even having to train somebody brand new, especially somebody who went through a fast-paced medical coding program, who maybe isn't as confident as they should be, even given the fact that they've already passed a certification. You know, you can pass a certification exam in medical coding and still not know what the heck you're doing, because sometimes people are just trained to pass a certification. And if you're in one of those programs, you know what I'm saying. So the thing about it is, guys, you know, we have to do our part as medical coders or as future medical coders to learn as much as we can. Well, Blue, how do I do that? I've already mentioned so many times the workbooks and everything that I have recommended, so I'm not going to go into that. The point of this video today is to talk about why temp positions or contract positions are a good place to start and why it is necessary. When you are holding out for a permanent position, say for instance you ignore my advice and you don't want to listen to me, and you say, oh, I don't have time for a temporary position, or I don't have a time for a contract position. I want to get a permanent job, and that's what I'm going to hold out for. Okay, so you're going to hold out for a while then. Okay, if you are actively out there, it could still take a while. Even if you have a really good resume, it could still take a while, because you have to get employers to trust you. You know, these positions in medical coding, they pay very well right out of the gate. If they're trying to pay you $12 an hour, that's a waste of your time. You can walk away from that. There's no reason that anybody should be working that low when they're doing medical coding. And there are some companies that try to get away with it. I know, because I see on the job listings. And I don't care if they say, oh, well, the coding's already done, they're just essentially pushing it through. No, no. When it comes to medical coding, it doesn't matter if the codes are already selected. Just because they're selected doesn't mean they're correct. That's number one. Number two, then your job is to make sure that whatever is there that is selected is actually correct. So you have to use your technical know-how. That's worth money, okay? So again, because these positions have to pay well, or they have to pay a decent amount, or what they're supposed to pay, and you can look in your area. Don't ask me, do not comment how much medical coders make, because every place is different, and that is a hard and fast rule of my channel. We do not talk about money, and don't make your comments either, because I have it that way on my channel, because we're about medical coding. We're not about the money. We already know that medical coders make good money. But that aside, you know, it would take a lot of trust for an employer to say, okay, we're going to hire you at this good amount of money, and we don't know you, we don't know your skill, you have no experience, but we're going to pay you this high dollar amount, which is sometimes the hesitation that these employers go through. So I can understand on both sides of the fence. However, what I see with employers is, if you have a candidate that can pass an entrance test, you should give them a chance. But that's my own opinion. And you know, it's on our leaders to change this conversation of we only want experience to start, which is ridiculous, again, because nurses don't have quite as hard a time getting in anywhere when they first start, right? And they've gotten out of nursing school and they're able to get jobs right away, whereas medical coders, they expect you to have experience. So it's a whole different conversation there. But again, going back to why some of these employers are a little bit hesitant about hiring new people. You have to train somebody who's already making good money how to do the job. And you don't know where they got their training from, or you know, what kind of teaching they had, which again goes back to the schools. The schools need to be better. We need to do better, medical coding schools. We do. Because it's ridiculous. Some of the things that I mean, by the time a coder gets to a medical coding certification exam, they should have a vast amount of knowledge, and a lot of them don't. and they're just pumping out people. And again, you can do your part as the coder to say, okay, even though I'm in a fast-paced medical coding program, I can still do better for myself because I can train myself. So there's that. So that aside, you're going to pick up that resistance from those permanent employers, those permanent position employers, which is why starting off with a temp agency or starting off with a contract position that is willing to hire you is a lot better. Because when I got my first job as a temp, I was working at the Cancer Therapy Research Center, and we were working on backlog. So what they had for us to work on was not as, it was still important that it was done correctly, but it wasn't dire. Like, this is a billable encounter that is going to go to insurance, and somebody's going to have to pay for this if I make a mistake and that kind of thing. So it was, while it was still important, it was good practice because it was still stuff that needed to be done. It was still stuff that, was important for statistics and reports and things like that. So for me going in and learning that part and getting through and learning all that stuff that I learned there, that helped me to get my second temp position because they had they were doing a little game, which now thinking about it, it was kind of stupid that they did this game, but whatever. But they did a game. They picked 3 temp agency people to come in. It was me and 2 other ladies, and we were all there and we were competing, and they were only going to keep 1 of us because they needed 3 of us to catch them up. But after that, it was only a 3-month assignment, and they were going to pick their candidate at the end. Of course, I didn't get picked, but it was a personality conflict more than it was technical ability, because I had technical ability, they even said. So anyway, I went from there to another temp agency position. Now, had I not taken that first temp agency position, I probably wouldn't be here today at my permanent coding home, which is where I had to go through those 2 positions, the Cancer Therapy Center, the other hospital that I worked at, and finally my permanent coding home. And so it took me a few tries to get in here, but that's okay. That is okay. It worked out, and it worked out because I was willing to accept a temporary position. So if you're nervous about taking a temp position, if you're saying, well, Blue, this is not really what I wanted, it's not always going to be how you imagine, right? It's not. It really isn't. Because again, if you're going to be so stubborn and hold out for a permanent position, like, no, I want to get a permanent position, just because you're in a temp position doesn't mean you have to stop applying. Okay, it doesn't. It just means that this is how you're making money for the time being. The thing about me, when I had my first position and I found out that I didn't get it, I didn't really panic, because I knew at the end of the day, I'm a worker. I have done blue collar work. That was where I started, right? And I delivered phone books, I cleaned houses, I worked at a bar, I've worked at restaurants, I've done all of those things. So I know I could always go back to that. So that the part that thinking, okay, well, if this job ends, I'm not going to have a job, didn't mean that I wasn't going to be able to make money. And see, that's the thing. A lot of times people are so set in, I'm a medical coder and that's all I want to do. And if I don't have a job, then I don't have a job. No, just because you don't have a job in medical coding doesn't mean that you can't have a job at any other place, at a restaurant or at a grocery store or even at a Walmart or Target or something like that. It doesn't mean that you can't still work. You can still work. And so there's a lot of things that people don't think about, and they have this thought process of all or nothing. And you can't do that when you're in medical coding, because with medical coding, you have to be willing to adapt, adjust course and adapt. I adjusted course, not once, but twice to get here to where I am permanently. Right. And again, it was taking that leap of faith. I had to move 8 hours away from my hometown for my second position. Now I had to move. Don't write me and tell me that you cannot move, guys. Don't do it. I always get that comment every single time I talk about that I had to move. I had to move. That was a choice that I made. My mom helped me, and that's how I was able to do it. But sometimes people have to sacrifice different things. I got a very good raise to go to that second position. That was why it was worth it. So that was why I went, and I and I worked there and learned everything that I could. Again, it was building skill. So instead of standing around waiting and saying, well, I can't get a job because I'm looking for a permanent position and everybody wants experience, they're going to keep wanting experience. But it doesn't mean that you can't still apply because they may be desperate that they'll go ahead and hire you, that you can't continue to study and get better with your coding skill, okay? Because they are going to test you. And if you can't pass your test, then you're not getting in for sure. So that's the thing, guys. Don't hold out because you're wasting time. That time that you're sitting there trying to get this permanent position that you're holding out for, you could have been going on different assignments. And when you work with a temp agency, those assignments add up. They add up on your resume, and you can say, well, I've had experience here, and I did this. And you're also able to make those networking connections. So there is a benefit to doing that. The con of waiting for a permanent position is, again, you're losing time. You're losing time and you're not doing anything. When I was waiting around, essentially, because I didn't know about the temp agency. It wasn't until, my mom encouraged me to go back to the school because I was looking for 2 months. I didn't know. There wasn't anybody like me on YouTube at the time to say, hey, go to the temp agency and get your start there and register with them and see if they can get you on a temp agency assignment. And that way you can build experience. There wasn't anybody like that. And so I had to go back to the school, and the principal was like, well, I have a friend who has a temp agency who works specifically for medical professionals. And you can Google that in your area, temporary agencies for medical professionals. And all the local listings should pop up. Okay. It's easy to do, guys. Just hit Google. Okay. And so, so he set me up with her. She said, okay, well, here's this test, and then we'll call you back, and oh yeah, you passed, and we'll give you a call in a week. Well, I had been hearing this, so again, I'm sitting here going back and forth to the bar and working, doing my bartending job, and then I'm working at the concession stand also on the weekends, and doing that, and I'm going to the halfway house and working with those folks. So I'm doing all of these jobs and I'm getting physically tired. I am. And so I understand if you're like, well, Bleu, I'm just really tired of working in these other jobs and I got this education, stick with it, guys. Trust me. Just stick with it. It's the ones that just give up and accept that failure that don't do anything with their certifications. And you just have to be patient. It's not going to happen right away. And that's what people want. And that's why I hate these like TikTok and Reels and things like that. These little quick bites, because that's what everybody wants. They want things now. They want that instant gratification. And that's not the way that this field works. This is far from instant gratification. It takes time and it takes patience to get to that fruit, right? And now I'm at the fruit part. The fruit part being that I understand what this field is. I didn't have a passion for this in the beginning. I see a lot of people say, oh, Bleu, I'm so passionate. I'm a student and I'm so passionate. You don't know yet. You like it. You're in that beginning stage, right? You like it. You don't know what it is yet. When you go through the process of what I've been through, as far as like in any coder actually, that discovers that it's a passion. When you go through that process of getting up, going to work, getting yelled at by your boss, by your coworkers, by your providers that you respect, and then you turn it around and you make something positive out of it, and you look forward to going to work. You know you're going to meet challenges, but it's okay because you're ready and you can do it with a smile on your face because you have that passion in your heart for what you're doing because you know that it's something above you. This field of medical coding health information, I know is above me. I am a small part of this, and it brings me joy to do it. And that's why I say I haven't worked since 2014, because I have the passion. I understand what it is. So that's the thing, guys. When you get there, you get it. But until then, it's going to take work. It's going to take time. It's going to take tears. It's going to take frustration. You are going to wonder what the heck did you get yourself into? But there are so many available resources. There's a lot of resources to help you guys to learn medical coding. Go to your local chapter meetings, network with other medical coders when it comes to like workshops and things like that. Don't go into Facebook medical coding groups. I've said this so many times, so I'm not even going to talk about it anymore. But go into those and try to learn as much as you can. Find a tutor, find a mentor. If you have to spend a couple extra bucks to get a tutor, it's worth it, especially if all you need is something to be explained to you. And sometimes that's all it is, because it's hard to learn it from a book always, right? But that's the thing, guys. When you are doing those things, you are making those steps and that effort, you're going to get to your goal. But again, you're going to come up against a lot of roadblocks. And I'm telling you guys to be open to accepting temp assignments or contract assignments, or, you know, in still looking for that permanent position. And if you say, well, Blue, I don't want to quit my job for a temporary job. Guys, I still worked while I had my temp job. So while I had my temp job, I was working in the evenings. I was literally working 7 days a week. Literally. No days off, because I was trying to keep my head above water and still trying to learn what I could in medical coding. And I still had my my job at the evening. So that freed me up. And it's a sacrifice that sometimes that you have to make. So again, I'm not telling you guys to quit your job if you have a permanent job, and I don't know if that's up to you. That's your opinion. That's your decision, because it's your life. But what I'm telling you is, if you're not working, don't hold out for a permanent position when you can easily get a temp position, and those things start to add up. And you never know who you're going to come in contact with. I'm just saying. So that's the thing, guys. Again, there's a lot of benefits to going with a temp agency or going with a temporary position to a permanent position. And sometimes that happens too, right? Where we get hired on as temps and it's going to be a permanent position after a certain amount of time. Again, they are going to be looking at your performance. They're going to be looking at how you adapt to different situations, because sometimes things they don't work out with other people that are in the office. So they're looking for compatibility, and that's always a good thing, because don't you want to be in a place where you're compatible with the people? So it is okay to take a temp to perm position, or it's okay to take a temporary position. It is okay to take a contract position. This is going to get you that experience, and it's going to get you moving, okay? Moving is a lot better than just standing still, looking around and waiting and getting frustrated about not being able to find a job. But guys, I'm going to wrap this one up with telling you that you have to get a good resume. I talk about resume tips all the time on my channel. I give them out for free, these tips for brand new medical coders. So you can look through my videos and check out my resume tip videos. I do resume rewrites. So if you're interested in that service, my rates are in the description box below. You can check it out, message me, and we can get going from there. But that is what I'm going to say on this video, guys. Don't turn your nose at opportunities, okay? Just because it's not something that you wanted to start off with right away. But just take a chance. That's it. That's all I'm going to say. So if this video helped you, please like, subscribe, share, and I will see y'all next time. Bye.